We've all been there, right? A paper cut, a stubbed toe, a headache that just won't quit. Pain is universal. But have you ever really stopped to think about what's actually happening inside your body when you feel that ouch?
You might think, well, I get hurt, and it hurts. Simple. But the science behind that feeling is way more fascinating than you might think. It's all about your body's built-in alarm system. And in this explainer, we're going to break down exactly how that system works. So, let's dive in.
So, the absolute best way to think about pain is as your body's own personal alarm system. It's a signal, a really important one, that tells you something's wrong. But just like real alarms, not all pain signals are the same. So first, we need to learn the basic lingo that doctors use to talk about it.
Okay, first things first, where is the pain actually coming from? Most of the time, the pain we feel is what's called nociceptive pain. That's a direct result of tissue damage, a cut, a burn, a bruise. But sometimes, the problem isn't with the tissue, it's with the wiring itself. That's neuropathic pain, and it comes from damage to your actual nerves.
Next up, how long does it last? Well, the International Association for the Study of Pain has a pretty clear cutoff here. If your pain lasts for less than 3 months, it's officially called acute pain. This is your classic short-term alarm.
But what if that pain sticks around for more than 3 months? Well, that's when it crosses a really important line and becomes chronic pain. This is when the alarm just refuses to turn off, long after the original problem is gone.
Now, chronic pain is a huge and complex topic, really for another day. So for this explainer, we're going to zero in on acute pain, that useful, protective alarm that tells you something's wrong and, importantly, goes away when you heal.
So, let's get into the nitty-gritty. How does that alarm actually get triggered? We're going to trace the entire journey of a pain signal, all the way from the injury itself, up your nerves, and into your brain.
So just to be super clear, acute pain is the direct result of some kind of tissue damage or inflammation. We're talking about the pain you feel after surgery, or from a burn, or even just a regular headache. The key thing here is that once the injury heals, the pain is supposed to stop.
Okay, now this is where things get really cool. Let's zoom way in. The second you get injured, your body releases this cocktail of chemicals right at the site of the damage. Scientists have a great name for it. They call it the inflammatory soup. And this soup is filled with all sorts of things, like histamine, serotonin, and a really important one we'll come back to, prostaglandins. This soup is what officially kicks the whole process off.
All right, so you've got this chemical soup flooding the area. But how does that actually generate a signal that your brain understands as ouch? Well, it turns out it happens in 2 main ways.
The first way is called direct activation, and it's pretty straightforward.